Hey, I'm Dr. Brian McKay at Core Health in Darien, and let's talk today about spinal decompression. Now, there's the surgical spinal decompression, and I'm happen to be a chiropractor, so we don't do surgery. We try to help people avoid surgery, and at times you cannot avoid surgery, so it's one of those options. So, non-surgical spinal decompression got its start basically by a neurosurgeon named Norman Shealy. Well, I actually had the pleasure of meeting a few times while he was still alive. Norman Shealy was besides a neurosurgeon, he's like a tinkerer. He invented what's called a TENS unit. If you know those little boxes that you see Shaquille O'Neal selling on these days. So what happens is these, for this decompression for one element, decompression. He was operating on people way too often. And he felt that, okay, it's got to be a better way. And one time he operated on the same person 9 times. And 9 times you just get scar tissue on top of scar tissue. And these days, we now know that you have enough scar tissue, you're going to develop stenosis, neuropathy, among other things. But really, scar tissue begets more scar tissue. You can only open somebody up so often and have it, if it works to begin with. But it obviously didn't work well enough. So I want you to imagine you take a tube of toothpaste. Don't worry, you don't have to go grab it right now. But when the last time you brushed your teeth, hopefully it was this morning or after lunch or this evening if you're listening now at night, and put the toothpaste on your toothbrush, and there's always a little bit left. You take the pressure off the tube, and all of a sudden that little dab goes back into its normal confines. That's exactly what spinal decompression does. So if you have a herniated disc, a bulging disc, or even stenosis, putting pressure either on the spinal cord or spinal nerve root, you're going to have extra bit of pain. They say it takes literally the weight of a dime on a nerve to cause pain. And a lot of times it's a chemical reaction. The disc and the nerve shouldn't come into contact. When they do, you have a different type of pain response. But hey, listen, pain's pain. You don't want it? Well, what are we going to do to get you out of it? That's where spinal decompression comes into play. So we started about 20 plus years ago. And I always tell a story about my hair club for men's store because I had a bad back. I needed relief. Salesman walked in one day, caught me on my way out the door to go to lunch, and basically outlined his great new treatment. And he was going from different doctor's offices. Now, you're not going to go into a surgeon's office because they're going to make a hell of a lot more money by cutting you open and doing surgery than they would with just literally doing this decompression. So it's a little bit different approach. So he was targeting chiropractors, and guy puts on a great picture. This machine's wonderful, and it made sense. Then he dropped the numbers like $125,000 for the machine. And I'm like, no. I'm trying to push the guy out the door. Instead of him leaving, he actually has his foot in the door. I guess it was a good salesman should do. And he's like, well, listen, how about this? He goes to me, I'll let you try it for 4 months, no charge. All you have to do is insure the equipment, and we'll send somebody up to set it up, teach your staff how to use it, teach you how to use it. And I'm thinking, like, wait a second. Now, at that point, I had a bad back for a couple of years. And believe me, I tried everything. I tried acupuncture, chiropractic, physical therapy, pain medication. I wasn't a surgical candidate, and I didn't want to go for surgery, but it was that desperate. So, lo and behold, they fly the machine up, set it up. I get on it. 20 treatments later, I'm 80% better. And by that point, all the exercises I had been doing became effective. A lot of times people think that if you do okay, I've got a weak back, you gotta fix it. Yes, you have to fix the muscles. But if you don't fix the underlying structure first, you're not going to get, it's not going to be the same response. I mean, you can work the muscles all you want. These muscles are working hard to begin with because there's a compromise. So what we have to do is we have to take off that. We have to make sure you're structurally sound. So the spinal decompression works by relieving intradiscal pressure using negative pressure. So kind of like when you release the pressure on a tube of toothpaste, goes back in, negative pressure. That's how it. That's how spinal decompression works. And does it really work? That's a question I get. Yeah, it does really work. Not for every case. I mean, there's no such thing as, you know, one thing is going to fix everybody. I kind of wish it was true. But another question we get is, can spinal decompression cause damage? Yes. Well, short-term damage more so, I would say, because if you put someone on it way too soon, there's a certain point where they're actually ready for it, and if they're not ready for it, they're going to be in more pain than they came in with. They had potential, and that's something you learn by treating. So, you're my patient 20 some odd years ago, you may have been subject to that. So it's really the provider, because really, I guess anybody could purchase this machine and do it, but after a while, you really know how to do it properly. And I think that's what sets us apart here at Core Health in Darien. So, having used it myself, got the benefit, really know how to work it, I think I'm a better teacher to other people as well. So it really can cause damage, but very rarely. Here's another silly question: can spinal decompression make you taller? Yeah, you're gonna get a little bit of disc height, but I wouldn't really go to the bank and say, "Hey, I'm 6'2", now I'm 6'4", or I was 5'3", now I'm 5'5". I don't think it's gonna happen that much, but we'll get some, but probably nothing tangible. Um, Another question we get is, can spinal decompression heal a herniated disc? Yes, yes. You got to get that genie back into the bottle, and spinal decompression does that pretty darn good. Pretty darn good. It gets that pressure off, but again, you need to make sure the structure is sound. You need good structural integrity there. You know, so the herniated disc, another thing too is bulging discs, kind of like the same. A bulging disc is just not as herniated. Herniated is like a little more serious in my eyes, but a lot of times those two terms are interjected. One question we received is, can spinal decompression help scoliosis? No, no, it's not. It's not a treatment for scoliosis. It really is not. Um, but now, someone has diagnosed with sciatica. Yeah, you can get good relief for sciatica, because that nerve root is that L5S1 nerve root that primarily is involved with sciatica, can really be problematic. So yes, it's great for sciatica. Now here's another one: low back pain. Yeah, spinal decompression is really good for low back pain, but again, it's part of a whole treatment. Got to understand that it's got to be part of a whole treatment. If not, then you're kind of wasting. You're wasting your time. But if you just do spinal decompression, yes, you'll feel better, but you have to take out the mechanical defects that caused it in the first place. So, here's another thing: spinal decompression for spondylolisthesis. Long, long spelling word: spondylolisthesis. This is where the bone is elongated at a certain part during when you're in the womb, basically. It's a congenital spondylolisthesis, or there's a traumatic event, and it affects what we call the area called the pars interarticularis. And when there's a pars defect or spondylolisthesis, sometimes spinal decompression is not indicated. This is where you really need an MRI and X-rays, if not a CAT scan, to make sure that you're a good candidate. That's probably the big takeaway. And spinal decompression for neck pain, hell yeah, it's great for neck pain. If people got radiating pain going down their arms into their fingers, a lot of times that nerve root is crunched up right at the spinal column, where the nerve exits what's called the intervertebral foramen. It's a hole on the side created by bone above, bone below. So that's a really, really good place to look for. So here's the thing: is spinal decompression safe? It's safe um, as the provider can make it for you safe. I mean, I think safety is of utmost importance, and what we got to take a look at is, people really need to, we really need to make sure. Well, again, nowadays with COVID, the place has to be clean. Tables got to be wiped down, and the corners, every little inch of that table needs to be clean. For the most part, it is safe. It's non-invasive, so you really save yourself a lot of trouble. I mean, how many people go into the hospital come out with MRSA or staph infections? pretty the number's kind of high. So that's really what we come across. Here's another. I guess this question is legitimate. Is spinal decompression covered by insurance? Some do, some don't. It really depends. Again, the provider, um, the provider, the provider's interpretation of codes. I mean, in a sense, you're actually doing a physical, like I would say, therapeutic. That extension where you decompress, the lengthening of the spine I would call it a therapeutic activity for sure, and that's how I would justify it. But it really comes down to what the practitioner feels like, what their thoughts are to make it either covered by insurance or not. So it's the main thing here is, do you want to avoid surgery? Well, this is the best way to do it. Now, again, you get these. Here's a bunch more questions. Can you do spinal decompression home without equipment? Well, those inversion tables are not a bad thing, but you're not going to get that negative pressure uh, where you can get the disc to reabsorb into its normal confines. Um, Again, using the analogy of the toothpaste in the tube, so it's a little bit different like that. So you're not going to have that same. Um, you're not going to get the same benefit. So yeah, I guess you can do inversion therapy at home, um, but well, it's probably worth a try because it's not going to be as expensive. I mean, a program of care could be anywhere from $4,000 to $7,000 to $8,000 for spinal decompression. So if you count that, that's kind of a lot. So you really may want to reconsider and just give it a try. Those inversion tables can't be much more than $200-300. So that's not a you know. Another question: can you decompress the spine without an inversion table? Depends if you're talking about the inversion table, the home one, or the ones that we have here in the much more expensive models that we have at the office. I guess you can decompress the disc. There's a technique within chiropractic called flexion distraction, which is where you create the same thing, not as long. It's a shorter treatment, and it does essentially the same thing. Um, Feels really good when you decompress the spine. Using this technique called flexion distraction. It's inherently a good feel, and really because you're pumping the disc, and I guess that's one way you could do it without the inversion table. It's just that um, there you're getting probably a 5 to 7 minute treatment where you could be on the table here for 35-40 minutes, so it's a longer time, and a little more controlled as well. So yes, you can get help with you can decompress the spine without the inversion table. Without equipment, kind of hard to do without equipment. I mean, that's the next question: spinal decompression without equipment. Well, I just don't see how, unless you get lucky. Maybe sometimes, yeah. I've heard of people getting tackled, they fall, and all of a sudden the bone pops into place, and it takes the pressure off. When it happens, great. You definitely save yourself a lot of time and a lot of time and hopefully a lot of money. All right, let's go. Oh, DRX 9000. DRX 9000 was a kind of a multi-level program set up years ago where you would buy that particular machine and they would mark it up quite a lot more than other machines that did the same thing, and then charge a marketing fee. So DRX 9000 itself is a good machine. My first machine was a precursor to that, and love the machine. Very very big, very very bulky. But that's where the DRX 9000, which people still look for, and not a bad treatment. But all the players all went away, so you don't have all this whole bunch of people who were marketing people as opposed to practitioners. Run the show. So it's wouldn't say it was a shit show, but it just took you're looking to heal patients, not make money off of them. I mean, there's nothing wrong with having a profit, but you want the people more concerned with this. And the DRX 9000 people were more concerned with the money aspect, and they provided marketing materials and rah rah, and they got the word out. So I guess it's not the worst thing in the world, but little too salesman-y for me. Maybe that's probably another thing that you want to look for. Okay, we get these questions all the time. Spinal decompression near me, spinal decompression therapy near me, spinal decompression chiropractor near me, manual spinal decompression near me, spinal decompression machine near me, spinal decompression treatment near me, spinal decompression chiropractic near me. So you gotta look. That's all you gotta do. And you know what too is, I'll be honest with you. When a patient comes in, if you're on the other side of this and you're looking to do decompression, call up somebody who's they have it on their website. You can put in spinal decompression near me, and what you can do is go talk to them. If they're not willing to talk to you, I wouldn't bother with it because there's other people who have it, who offer it. But go in and just say, listen, I would like some more information. Can you spend 10, 15 minutes or get a phone call out, later in the day, so it's people should be approachable. If you're going to come to me and you want, 5 minutes of my time, 10 minutes of my time, and I can call you on the ride home from work or, when I have the time, it works both ways. So I would encourage you to speak to the provider or make sure they're educating you. That's one of the things you really must do is be educated about it. Because again, if you're just coming in just for the treatment, just for the decompression alone, you're not going to be the same unless you get the structure, because you can't alter the structure and have it function at 100%. So that's a big thing. Let's go over some more questions. A lot of these are just the same ones we already had. Spinal decompression with a towel? No. Spinal decompression for scoliosis? Absolutely not. Sciatica? Yeah. Herniation? Disc? Yeah. I guess that towel thing comes up a couple times. What happens is I get a whole bunch of questions and I just start answering them. And spinal decompression with bands. I don't know what band. Those TheraBands, I don't see it happening. Stretching, yeah. Decompressing, absolutely not. With a pull-up bar, no. Spinal decompression with fusion. You shouldn't do fusion if you don't. I'm sorry. If your doctor says you need to have surgical fusion, you do it. I mean, there's no mystery on that level. But what you have to think about is how, if it doesn't work, you got to wait a while. You really have to wait a while. I would say, almost a year. That's really, a year before I would say, okay, I'm going to touch you. Because it just doesn't make sense. You have back pain and surgery doesn't work. That scar tissue has to heal. And quite honestly, I wouldn't. Even 6 months is too early. If you have the surgery, afterwards you do your physical therapy, which you should do. Give it a little bit of time to take. If it doesn't take, after a year, I would talk to you. But I'm not running out looking for these patients, especially, because maybe they would have responded if they tried it first, but we don't know. So that's the thing: is foam roller, spine decompression. You can actually, rolling is really helpful to work with the curve, the natural curve in the back. So it's not going to decompress the spine. It will disperse the fluids. It doesn't create the negative pressure within the disc space to get that nerve to pop back into, not the nerve, the disc to pop back into place. So yeah, foam rollers can help, but spinal decompression with discectomy, you're going to a surgeon, dude. I can't help you with that. If you have a discectomy where there's no disc to decompress, so that's kind of like a silly question as to what we what we've got going on there. So basically, I hope I've answered a bunch of your questions on spinal decompression. It is it's It's a wonderful, wonderful technique. When it's applied properly, it can work beautifully. And again, not everything works every time on every person. So understanding those limitations, you know, you might not get that result that you're looking for. But if you go to the right practitioner, make sure you have confidence in the person. I mean, that's really important when people walk in. I'll give you an example. I had a patient come in, and all she kept saying is, well, my brother-in-law is an orthopedic surgeon. He says I should do this. I go, he doesn't treat you. He's not treating you. You come here for my care plan. I'm more than happy to talk to him. I'll send him your x-rays. And she never really had the confidence in me. And she stopped coming in, and she's going to go to a physical therapy mill, because nowadays this physical therapy corporation was taken over by private equity, and the care sucks. And I know it sucks because I've had 6 people there looking for work over here with me. So, it's one of those things that have the confidence. Like, listen, it's nothing. Her decision is very personal. I'm busy enough. I'm not worried about losing a patient, but I think I could have helped her, but she didn't have the confidence in me. She would go, well, my brother-in-law is an orthopedic surgeon in Ohio. I said, that's great. We're here in Connecticut. How's he going to help you? Well, he says I should do physical therapy. Well, then go do physical therapy. Even though I have a physical therapist here in my office, he was saying to go to this particular physical therapy office that he wasn't really connected with. But again, listen, she didn't have the confidence, and she bolted. Unfortunately, she's probably not going to get better. And I'm saying that because I did start to really understand that you don't know a patient's true needs and how it's going to work right off the bat. So you really sometimes have to, it takes a little bit of time. All right, so listen, I've talked your ear off enough. It is 7:22 a.m. on Sunday, June 28th. This time next week, we will be having celebrated July. Hopefully a little less COVID in the air. That would be nice. A lot less COVID in the air, even better. And what we should think about doing is reconvening at another time. I put these podcasts out for your information. If you have a question, feel free to reach out to me. My name is Dr. Brian McKay, Core Health in Darien, 203-656-3636, 203-656-3636. All right, listen, have a great day. Talk to you soon.